Welcome, and thank you for joining us today. My name is Ellen Wilson, and I'll be the moderator for this expert briefing for the media, which is hosted by the Johns Hopkins Bloomberg School of Public Health. The COVID-19 pandemic has largely spared the lives of children. According to the Centers for Disease Control and Prevention, 700 children have died in the US since the pandemic began, compared to the nearly 700,000 adults who have died across the country. Still, children have suffered enormously from COVID-19. Bloomberg School faculty members will discuss the latest updates and research on upcoming COVID-19 vaccines for children and how to promote their uptake among young people and families. They will also discuss how the pandemic has affected youth mental health and worsened pre-existing disparities in education and health, and new research and policy recommendations to address these challenges. Please note that participants are welcome to use images, video, or quotes directly from the briefing, and that the content is for immediate release. First, I'd like to briefly introduce our two speakers. Dr. Kausar Talat is a physician who is board certified in pediatrics, internal medicine, and infectious diseases, and whose research focuses on vaccines. Currently, she's the Johns Hopkins site PI for the Pfizer COVID-19 vaccine trial, which is currently enrolling children as young as 6 months old. With extensive work in the area of vaccine safety, Dr. Talat is the Johns Hopkins PI for the CDC Clinical Immunization Safety Assessment Project. Dr. Tamar Mendelsohn is a Bloomberg Professor of American Health, Director of the Center for Adolescent Health, and co-lead of the Adolescent Health area of the Bloomberg American Health Initiative. Trained as a clinical psychologist, she evaluates strategies to improve mental health among adolescents in urban communities. During the pandemic, she is evaluating adolescent mental health and working with community partners to develop an interactive website called Voices on Vax to increase vaccine confidence and uptake in Baltimore. We will have time for questions following our panelists' remarks. The procedure will be as follows. We will take some questions that have been submitted in advance of the briefing and some questions from the Zoom chat. If you have a question during the briefing, you can enter it in the Zoom chat addressed to all panelists. Please enter your name, media outlet, and question. We hope to cover as many as possible. Just a note that participants will be muted during this briefing and it will be recorded. Dr. Talat, please go ahead.
Thank you very much, Ellen. It's my pleasure to be here today. I want to start off by saying I've been asked lots and lots of questions about whether children need vaccines because they're not as affected by COVID as adults. And I think we've learned a lot over the last 20 months of this pandemic. Initially, that's true. Children weren't as affected. We had very few infections in kids. We weren't sure that kids even were able to get the virus or to get ill with the virus the same way that adults were, or to transmit the virus. But we also took our kids out of school. We kept them at home. We kept them away from their friends, and we sheltered them so that they would stay safe. As things have started to open up, especially in light of the surge that we've seen with the Delta variant, what we have seen are more and more kids getting infected with COVID. And even though for most of them, the illness is mild, if you have millions of children being infected, some of them are going to be hospitalized, some of them are going to end up in the ICU, and unfortunately, some of them are going to die. And what we've seen over the last couple of months is those rates have gone up significantly. In September, we had over 1 million children infected with COVID. We had over 41 children die of COVID, and that's 41 deaths too many. And one way we can protect them is by getting them vaccinated. And what we know, what we have the great pleasure of knowing is that these vaccines have been used in hundreds of millions of people in the United States. Over 400 million doses have been given, and billions of doses have been given worldwide. And these vaccines have been shown to be very safe and efficacious in adolescents and adults. And the early results from the trials show that the vaccines are also safe in children. Now, children aren't little adults. We can't give them exactly the same vaccine that we gave to, in the same dosage that we gave to adults and older kids, which is why we started over. When we did the trials on the kids, we looked at different doses to find the safest dose, the dose that gave the best immune response, and we settled on a dose that's a third of the dose that is given in adults. And with this vaccine, kids can then go on and be able to stay in school and not have their classes shut down because of outbreaks. They can hang out with their friends, they can learn, they can be happy, they can have their normal social and emotional development, and their lives can go back to something that's better than being locked at home on remote schooling. Not being able to see their friends. So the vaccines will protect them and keep them safe. And it will also protect our communities too, and people who are vulnerable in our communities who either can't get vaccinated, like younger children, or or people who don't respond as well to the vaccine and have underlying conditions that make them more vulnerable. So vaccinating kids will benefit them both physically, as well as allow them to develop emotionally. And also it will benefit the community as a large. Thank you.
Thank you, Dr. Talat. Now we will hear from Dr. Mendelsohn. Dr. Mendelsohn, please go ahead.
Thank you. And it's wonderful to be here with all of you today. So to build on what Dr. Talat said, youth and families are really being bombarded with misinformation about vaccines over social media right now. And that creates a lot of anxiety and confusion. So many people have not made up their minds against the vaccine, but they want more information or they're worried about things that they've heard. So it's really important that we reach the community, and trusted messengers are really important. As one example, our center is working with partners on an initiative called Voices on Vax in Baltimore, where youth ambassadors from the community serve as trusted messengers. And, the bottom line is really we need to find ways to promote vaccine confidence, and especially now as a vaccination is becoming available to younger children. Another key piece here is mental health. So youth mental health was already a public health concern before the pandemic, and that has only grown in importance. Youth depression and anxiety and suicide have spiked during the pandemic. We don't yet have the long-term data to know what the effects are going to be over time. But what we do know is that many young people have experienced extreme trauma, like losing a parent, that's likely to have long-term impacts. It's estimated that over 175,000 young people in the US have lost a parent or grandparent due to COVID. And the pandemic has also worsened pre-existing disparities in youth health. So youth living in poverty who are disproportionately Black, Latinx, or Native American are at particular risk for physical and mental health problems and academic problems due to COVID. And this is really because of systemic problems, so structural racism, for example, and economic inequalities. We know that children of color are more likely than white children to have lost a parent during the pandemic. And there are a lot of systems issues that are causing harm to young people, including underfunded schools, healthcare access barriers, food and housing instability, and lack of adequate transportation. One thing that we've seen in Baltimore is that many young people have been hungry during the pandemic due to less access to meals through schools. And this is a key issue. So COVID should really be a wake-up call for us to make some key changes. We need policy changes that are going to promote universal access to quality education and mental and physical health care. And it's really critical that we integrate mental health supports into the systems that serve young people. Schools are a great place to do this. So, having on-site mental health professionals in schools is one way to meet kids where they're at and support their healing. Also, having trauma trainings for all school personnel, And really using non-stigmatizing, strength-based approaches can help promote student well-being. And that includes things like social emotional learning programs, mindfulness, restorative practices. We have great evidence for strategies that work. And really, schools need funding and infrastructure to support these kinds of changes to promote youth healing. Thank you.
Thank you, Dr. Mendelson. Now we will take questions. If you have a question, again, reminder, please enter it in the Zoom chat with your name, media outlet, question, and to whom you'd like to address your question. Here's the first question from Paulina Ferozi at the Washington Post for Dr. Mendelson. 3 groups, including the American Academy of Pediatrics, said they are declaring a national state of emergency in children's mental health. What is your reaction to this kind of formal declaration, and what resources are needed to help young people struggling with their mental health, especially children and teens who may not have easy or equal access to mental health resources or resources in schools?
Yeah, this is a great question. I really do applaud these declarations, and I agree that we're in a state of emergency. I think that I already mentioned schools, but I'm going to mention them again because I think this is really a key context for addressing youth mental health. And for young people who may have insurance and other access barriers to outpatient or other types of mental health services, this can be a first line, a gateway where they can receive potentially evidence-based assessments and interventions. And I also just mentioned some interventions that can be useful kind of for all students in a school, even without being pulled out for specialized support. So I think really thinking about ways that we can infuse evidence-based programs that can be delivered to all students to support positive coping and emotion regulation, it would be very helpful.
Thank you so much. Here are 2 questions from Litzy Tanner from the Associated Press for Dr. Talat. What are the biggest challenges and potential hurdles for vaccinating all U.S. children ages 5 through 11?
That's a really good question also. And as Dr. Mendelson said, vaccine hesitancy is one challenge. I think that we have politicized this pandemic and vaccines during the pandemic tremendously. And so vaccine hesitancy has become a really big obstacle to getting everybody vaccinated, adults and children. We need to make sure that people have accurate information about the vaccine, accurate information about the risks of COVID, not just for adults, but for children as well. Children can get long COVID, children can get this multi-system inflammatory syndrome, and trying to educate and speak to parents about their concerns and listen to their concerns so that we can overcome some of that hesitancy.
Great, and a follow-up question. Do you anticipate a smoother, more efficient rollout than for the initial COVID vaccines for adults? Why or why not?
Well, first thing is I think we've learned a lot from the initial vaccine rollout for adults. And we also have a lot more vaccine volume. There's 28 million kids between the ages of 5 to 11. And we definitely have 28 million doses of vaccine available for them. And in addition, the rollout to kids will happen not at big mass vaccination sites, but at their doctor's offices, at places where they already go regularly and where there is a lot of trust established. Now, this obviously will potentially leave out some kids who don't have regular doctors that they go to. And so safety net systems need to be put into place so that all kids have access to the vaccine.
Great, thank you so much. Here's a question from Kirsten Garris at Cox Media Group for Dr. Mendelson. The CDC reports more than 140,000 children are now orphans after losing a primary and or secondary caregiver to COVID-19. What kind of mental health impact could this kind of tragedy have on a child? And how does age play a role in how a child might process this death? I.e., how might a 6-year-old process this loss compared to a high school senior?
Yeah, thank you for that. So losing a parent is probably one of the most profound losses or traumas that a young person can go through. And it is something that takes time to process. The good news is that family support and love, other family members and trusted people in a young person's life can be a huge source of support during this time. We do know that younger children have additional challenges because they're more dependent on caregivers. And in terms of their cognitive development, it's going to be harder for them to understand what death means and to process that. We have evidence-based treatments that address youth trauma and loss. And so, being able to link young people with those resources is really key.
Great, thank you so much. And here are questions from Ellison Chu at the Washington Post for Dr. Talat. Are there concerns among pediatricians and public health experts that coronavirus vaccine hesitancy is going to impact support for childhood immunizations? Why or why not?
So most kids get their childhood immunizations. Most childhood immunizations are given before kids are old enough to get a coronavirus vaccine. And I think many people differentiate the routine childhood immunizations from the COVID-19 vaccine. And so I haven't heard much from pediatricians about concerns of hesitancy spilling over. But what had happened early on in the pandemic is with the shutdowns and things closing down, there was a lot of kids who missed their vaccinations and didn't get their vaccinations on time. And so it's really important to make sure those kids are caught up and that the routine vaccines continue to be given even during the pandemic and even in the midst of the COVID vaccine rollout.
A follow-up also from Ellison Chu at the Post. I understand there is a push for pediatricians' offices to administer coronavirus vaccines. What impact could this have on addressing vaccine hesitancy?
I think it'll make a big difference in addressing vaccine hesitancy because people trust their pediatricians and they go to them for guidance and for support when their kids have problems. And so to have their trusted care provider say that this is a good vaccine and you should give it to your child, especially as a lot of pediatricians have already been starting to say this to parents for many months prior to the vaccines even being available, and to ask them about their vaccination plans helps normalize the conversation and get them used to the idea that their kids will get vaccinated.
Great, thank you. And here's a question from Kate Amara at WBAL TV for both of you. When shots in general can produce so much stress and anxiety in children, what is your advice for parents of 5 to 11-year-old children when taking them for their COVID shots? I've been asked by my own twin 9-year-olds, is it a different needle? Will the doctor be dressed like an astronaut and all covered up? What happens if I feel really sick after, like you did? Dr. Mendelsohn, let's start with you.
Yeah, great question. So first, I think that it's important for parents to model. If we seem really anxious and upset, our kids are going to kind of get that vibe off of us, right? So I think, treating this in a matter-of-fact way, in the same way that we would treat standard vaccinations. If kids are anxious, for younger kids, bringing along a trusted stuffed animal or something, little game to distract them, whatever's going to bring them comfort can be helpful. But I think not hyping this beyond the sort of routine medical kinds of care and typical vaccinations that they get every year could be really kind of helpful for lowering young people's anxiety.
Great, thank you. Dr. Talat.
I couldn't agree more. Just make it routine, make it normal. It's a matter of fact conversation, not a scary thing. And also you can even practice it at home with, give pretend shots and say, it hurt a little bit and now it's all better and let's put a Band-Aid on it. In terms of what the nurse will be wearing, because it's COVID, they'll probably be wearing masks and maybe a face shield. So just to prepare kids for that, so that they're not scared when they go there and see that. But that's just because of the times that we're in and not because of the particular vaccine that they're getting.
Great, thank you. Here are questions from Amy Lunde at the Hub. Let's start with you, Dr. Talat. What is the potential timing of child vaccines if approval goes smoothly without hiccups? Do you think vaccination will be open to all kids or those with health issues first?
So if everything goes absolutely smoothly, early November is the earliest time. So the FDA's advisory committee is meeting on October 26th to discuss pediatric vaccines. Depending on if the FDA authorizes an emergency use authorization for those vaccines, the CDC has a meeting scheduled November 2nd and 3rd for their advisory committee to hear the data and to vote on this. And if everything goes well, then if they vote to recommend the vaccine, it could be available by the end of that week. It may take a few extra days, but that's the earliest it would be available. And then, yes, it would be available for all kids 5 to 11, regardless of pre-existing history, just the same way that it was for the adolescents 12 to 15.
Great, thank you. And a follow-up on that, how should parents navigate the world with their kids with fall, winter holidays approaching, Dr. Talat?
Get them vaccinated as soon as you can. I have a 10-year-old and we're very excited that he'll at least have gotten his first dose before Thanksgiving, hopefully. Continue to wear masks, look at the local COVID rates in the area that you're traveling to. If you're traveling over the holidays, consider having everybody do tests if you're gathering in one area, in one house, so that you know if somebody has really high levels of COVID that they're shedding. The rapid antigen tests will test somebody who has really high levels. Just be careful. Outside is better than in. Everything that we've learned over the last 18 months. Last year, a lot of the holidays were canceled because of COVID. And so it's important for families to gather, but to do it carefully.
Great, thank you. Questions from Sarah Kim at WYPR in Baltimore. Starting with you, Dr. Mendelson. What should schools do to better ensure that students have better support systems and have the space to heal from this pandemic?
Yeah, so I've mentioned a few of the strategies. Ideally, schools should have on-site mental health professionals that can really be helpful in terms of being able to do screenings and really address the needs of kids who may be struggling. But in addition, trauma trainings for all the school personnel are really helpful, just so that folks are more sensitized in what young people are going through and how to respond in a supportive way. And then the kinds of programs and activities that promote well-being and healing. Restorative circles are one thing that many schools in Baltimore are doing. So there are ways of kind of integrating these things into the school day in a way that just supports young people in being able to be present and feel seen and be able to then concentrate on learning.
Thank you. Thank you. And for you, Dr. Talat, what can state and local health officials in Maryland do to make COVID vaccines more accessible for children?
I think one thing that can be done is to have vaccination drives at schools where kids are used to going and feel comfortable in. I know when the adolescent vaccine was rolled out, our school district did that, and they had them over the summer, and then they had them on the weekends when school started. I think especially for kids who don't have a regular doctor, don't have regular access to healthcare, that's the best way to make sure that those kids also have access to the vaccines.
Great, thank you. And a question from Hallie Miller at the Baltimore Sun for you, Dr. Talat. In Maryland, we're hearing that about 40% of pediatricians have indicated they won't be doing childhood COVID vaccinations due to storage and staffing constraints. Do you know if this is common elsewhere, and what are some possible solutions to this problem that would also allow for equitable solutions?
That I hadn't heard that. The vaccine is actually stable at refrigerator temperatures for several weeks. And so you don't need the ultra cold temperatures that we heard about a lot earlier during the rollout. A pediatrician's office should be able to store vaccines in the regular vaccine refrigerator. Maybe that they just don't have space. And the training does take time. You have to dilute the vaccine in order to be able to administer it. And the nurses need to be comfortable doing that. But I had not heard that that was going to be a big problem with pediatricians.
Okay, thank you. Here's another question for you from Sierra McCarthy with the Fort Worth Star Telegram. What do we know about children who are immunocompromised or who are at higher risk of getting seriously ill from COVID and the vaccine rollout? Will the recommended doses be different for those children?
That's a really good question. Right now, we don't have a lot of data on those kids because the trials generally excluded kids with severe immunocompromise. But if you can extrapolate from the adult and growing adolescent data, I would say that it is likely that those kids won't have as robust of an immune response to the vaccine that kids who aren't immunocompromised have. And so it's important to vaccinate the people around them that they come into contact with, because that will give them an additional layer of protection. So you can cocoon them in vaccinated people. And so even if their immune response isn't as good, they're still protected. It'll be interesting to see what the CDC's advisory committee recommends in terms of changes in doses, but I haven't heard anything about it at this time.
Great, thank you. Here's a question from Kate Amra at WBAL-TV for both experts. Do you suggest families wait to travel and/or other holiday plans until their child under 12 reaches full immunity? Has research shown there is moderate protection before that point? Let's start with you, Dr. Mendelsohn.
So I also have a 10-year-old, and personally, I would not travel until she has been vaccinated and reached full immunity. People have different comfort levels, but I think given the Delta variant and just how easily transmissible that is, I would be more comfortable waiting. And I think there is some degree of immunity one gets even before you've reached the full level. But, given the potential risks there, I think it's important to wait. But Dr. Talat, add to that.
Dr. Talat, please go ahead.
So we have differing views because we are going to be traveling. I was hoping that we would have both doses before we travel for Thanksgiving. But it's likely that my son will only have one. But what we saw from the adult data is that within a couple of weeks after vaccination, now I want to caveat that with saying that wasn't the Delta variant, that was the old Wuhan variant of the SARS-CoV-2 virus. That we saw really good protection, at least short term, within a couple of weeks after dose 1, and that dose 2 increased that and made it last longer. I think you have to weigh the risks and benefits. We are traveling. Everybody else except for my son will be vaccinated. The place we're staying, everybody will be vaccinated. We're going to do rapid tests on everybody to make sure that there's nobody who's shedding virus, and he wears a mask all day long. He's just used to it, and so we'll continue to have him stay masked. So I think you weigh the risks and benefits for your family, and it's a very personal decision in many ways.
Great, very thoughtful answers here. And here is a last question from Amy Lunde at the Hub for you, Dr. Talat. Will the vaccine for ages 5+ be available in local pharmacies the way the adult vaccine is?
So I don't know the answer to that question. I know that the primary target is pediatricians' offices, and pharmacies should have it. You have to be careful because it's 2 different formulations. So the adult and adolescent formulation comes in 1 vial. And even though it's the exact same vaccine, it's given at a lower dose. So the pediatric formulation is in a different vial. It should be available in the pharmacies. I don't know how many of them will carry it. Just make sure that they're giving it from the pediatric file.
Great. Thank you to both of you, to Dr. Talat and Dr. Mendelsohn, for your presentations and really insightful answers. We will email the links to the resources mentioned today and share it in the chat. And with that, I'd like to say thank you again to everyone for joining us today.